Medical News from BMJ, Clinical Research Edition. Stereotactic radiotherapy for neovascular age-related macular degeneration, Year 3 and 4 extended follow-up results of a randomized, double-masked, sham-controlled, device trial, STAR. A recent study has found that stereotactic radiotherapy, a treatment previously thought to be effective for neovascular age-related macular degeneration, may not be as beneficial as once believed, with patients experiencing inferior vision compared to those receiving standard care. This matters because neovascular age-related macular degeneration is a leading cause of vision loss in older adults, and effective treatments are crucial to preserving vision and quality of life. The study's findings have significant implications for the treatment of this condition, highlighting the need for ongoing evaluation and reassessment of emerging therapies. Neovascular age-related macular degeneration is a chronic and debilitating condition that affects millions of people worldwide, causing significant vision loss and impacting daily activities. Despite the availability of antivascular endothelial growth factor, anti-VEGF, injections, which are the current standard of care, many patients continue to experience vision loss and require frequent injections, highlighting the need for alternative treatments. The stereotactic radiotherapy for wet age-related macular degeneration, STAR, trial was designed to assess the efficacy and safety of stereotactic radiotherapy, a non-invasive treatment that uses low-dose radiation to reduce the growth of new blood vessels in the eye. The STAR trial was a randomized, double-masked, sham-controlled, device trial that involved 411 participants with chronic, pretreated, active neovascular age-related macular degeneration, recruited from 30 NHS hospitals in the UK. Participants were randomly assigned to receive either a single dose of 16 Gray stereotactic radiotherapy or sham radiotherapy, delivered using a robotically controlled device. The primary outcome was the number of anti-VEGF injections required over 4 years, with secondary outcomes including visual acuity, adverse events, and microvascular abnormalities. The study design allowed for extended follow-up, with participants reverting to routine care after 2 years, but with masking maintained, and repeat data collection at years 3 and 4. The results of the study showed that participants who received stereotactic radiotherapy required a mean of 19.1 injections over 4 years, compared to 21.6 injections in the sham radiotherapy group, representing an adjusted decrease of 3.2 injections. However, during years 3 and 4, the number of injections required was similar between the two groups, with 8.4 injections in the stereotactic radiotherapy group and 8.3 injections in the sham radiotherapy group. The final change in visual acuity was 8.3 letters worse in the stereotactic radiotherapy group compared to the sham group, indicating inferior vision in the treated eyes. Adverse event rates were similar between the two groups, but microvascular abnormalities were more common in the stereotactic radiotherapy group, occurring in 58% of treated eyes compared to 16% of sham-treated eyes. The study's findings have significant clinical implications, suggesting that stereotactic radiotherapy may not be an effective treatment for neovascular age-related macular degeneration, despite initial promising results. The inferior vision in treated eyes effectively reverses the conclusions of the initial 2-year analysis, highlighting the importance of extended follow-up and ongoing evaluation of emerging therapies. The study's results also underscore the need for careful consideration of the risks and benefits of new treatments, particularly in the context of chronic and debilitating conditions like neovascular age-related macular degeneration. The study's limitations include the potential for bias and the relatively small sample size, which may impact the generalizability of the findings. Additionally, the study's results highlight the complexities of treating neovascular age-related macular degeneration, and the need for ongoing research and development of effective therapies that can preserve vision and improve quality of life for patients with this condition. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.